ahead.
Hey there, I'm Sarah. I'm going to be your nurse today.
Hi.
How are you doing?
Good.
Good. Can you tell me your first name?
Ashley Best.
Okay. And what's your date of birth?
4/16/86.
All right. And where were you born?
Greensboro, North Carolina.
All right. And are you single, married, divorced, separated?
Single.
Okay. We're going to go over a health history here. Everything that we go over is confidential. It's going to take a little bit, but we need to be thorough.
Okay.
Okay. Do you have any communication barriers that I need to know about?
No.
Okay. In your own words, can you tell me why you're here today?
Just been having some allergy symptoms like sneezing, runny nose, stuff like that.
Okay. And is this worse than normal?
Yes.
Okay. As far as your past health history, as a child, did you have measles, mumps, rubella? Did you have the chicken pox?
Yes, it is the chicken pox.
Okay. Rheumatic fever, polio, anything like that?
No.
Okay. As far as your immunizations, do you recall getting a tetanus or hepatitis or MMR shot, anything like that?
Tetanus shot in the last 10 years, I know. I'm
Okay.
not sure about the other ones.
Okay. Did you get a flu shot this year?
Yes, this October.
Okay. How about a pneumonia vaccine?
I did last year, so 2014.
Okay. When's the last time you had a physical exam?
1 year ago, last December.
Okay. Have you had any accidents or injuries recently?
No.
Do you have any children?
No.
Okay. Any significant medical problems?
Just asthma and allergies.
Okay. Any surgeries at all?
No.
How about any hospitalizations?
No.
Okay. Have you ever had a blood transfusion?
No.
Okay. Do you have a list of your medications or do you know them?
I just take Advair 250/50
Uh-huh.
twice a day,
Okay.
and then I take Flonase as needed.
Okay. Do you have any allergies to medications?
No.
All right. As far as your health habits, do you work out? Do you exercise?
Yes, about 4 times a week,
Okay, for how long?
30 minutes usually.
Okay. Are you currently dieting?
No.
Okay. Do you drink any caffeine at all?
About 1 cup of coffee a day.
Okay. How about alcohol? Do you drink alcohol at all?
Occasionally, but rarely.
Okay. What kind do you drink?
Wine.
Okay. About how many drinks per day?
I'd say 1 plus every couple weeks.
Okay. Are you concerned about the amount that you drink?
No.
Have you ever considered stopping? Have you ever experienced blackouts or binge drinking?
No.
Okay. And do you drive after you drink?
No.
Okay. Do you use tobacco at all, cigarettes or chew or
I
anything
don't.
like that? Okay. Do you use any street drugs or recreational drugs at all?
No, I don't.
Okay. Have you ever given yourself any drugs with a needle?
No.
Okay. Are you sexually active?
No.
Okay. HIV and AIDS are a major public health issue. Do you need to talk with anybody or have information about that today?
No.
Okay. Do you live alone?
I have a roommate.
Okay. Have you fallen at all recently?
No.
How's your vision and hearing? Have you been having any changes?
No, it's been fine.
Okay. Do you have an advanced directive or living will?
I don't.
Do you care for information about that today?
Not right now.
Okay. Physical and mental abuse are a big issue in this country. Do you have any concerns about that or need to speak with anybody about that?
I don't.
Okay. As far as your family history, we're going to talk about your mom and your dad and your grandparents.
Okay.
How old is your father?
He's 60.
Okay. Does he have any significant health problems?
He does not.
How about your mom?
My mom is 60 as well. She has multiple sclerosis and high blood pressure.
Okay. Do you have any siblings?
Yes, a brother.
Okay. How old is he?
27.
Does he have any medical issues at all?
Not that I know of.
Okay. And you don't have any children, is that right?
No.
How about your mom's mom? How old is she?
She's 89.
Okay. Does she have any significant health issues?
She's had a stroke, high blood pressure. I believe that's it.
Okay. How about your mom's father?
The only thing I know of for him, he's 89 as well. He has AFib.
Okay. And your dad's mom?
She's 87. No significant problems I know of.
Okay. How about your dad's dad?
He, 87 as well.
Mm-hmm.
He's had a heart attack a few years back,
Mhm.
and he has heart failure and AFib as well.
Okay. Any other pertinent family health history that we need to know about?
I don't think so.
Okay. We're going to talk about your mental health a little bit. Is stress a major problem for you?
It's not.
Okay. Have you ever felt depressed?
No.
Okay. Do you panic when you're stressed?
No.
Do you have any problems with eating or your appetite?
No.
Do you cry frequently?
No.
Have you ever attempted suicide?
No.
Have you ever seriously thought about hurting yourself?
No.
How's your sleeping? Do you have any trouble sleeping?
I'm sleeping fine.
Okay. Have you ever been to a counselor?
No.
Okay. At what age did you get your first period? Do you remember?
I believe I was 12.
Okay. Do you remember the date of your last period?
3 weeks ago, so second week of October.
Okay. So like October 14th
Yeah.
or 10th?
Mm-hmm.
Okay. And you get your period pretty regularly?
Yes.
Any spotting or pain, anything like that?
No.
And you haven't had any pregnancies?
No.
Do you have any vaginal itching or discharge? Okay. Do you get frequent UTIs or bladder or kidney infections at all in the last year? Okay. Any blood in your urine?
No.
Any trouble with control of your urination?
No.
Okay. Do you have hot flashes or sweating at night?
No.
All right. Do you have menstrual tension, pain, bloating, anything like that associated with your period?
No, not normally.
Okay. As far as your breasts, are they tender? Have you noticed any lumps or anything like that?
No.
Okay. When was the date of your last pap smear?
2 years ago, so December 2013.
Okay. And everything was normal?
Yes.
Okay. We're going to go over kind of a review of your whole body.
Mhm.
Overall, have you had any recent weight loss?
No.
Any fatigue or weakness?
No.
Fever, chills, night sweats, anything like that?
No.
Okay. Your skin, do you have any skin diseases like eczema, psoriasis, hives, any kind of rash, anything like that? Any mold changes?
No.
Okay. Your hair, have you noticed any recent loss of hair or texture change, anything like that?
No.
Okay. Are your nails pretty normal for you? They're not brittle or anything?
No. Normal.
Okay. Have you had a head injury recently?
No.
Do you experience frequent or severe headaches?
No.
Okay. How about dizziness or vertigo?
No.
Okay. Do you wear contacts or glasses?
I don't.
Any vision changes or blurriness in your eyes?
No.
Okay. Do you have often earaches or infections?
Not usually, no.
Any vertigo or ringing in your ears? Okay. Now you said you're here for allergies, so as
Mhm.
far as your nose and sinuses, do you have a lot of drainage?
Yeah, a lot of runny nose, sneezing, watery eyes.
Okay. Do you get frequent colds, or it's mainly just your allergy
It's
symptoms?
just allergies that will come and go. It seems like not stay for a few days.
Okay. Do you get nosebleeds?
No.
Okay. As far as your mouth and throat, do you have any sores or ulcers in your mouth at all?
No.
Okay. Do you follow up with your dentist as suggested?
Yeah, I usually go once a year.
Okay. Have you noticed any bleeding gums or painful swallowing, anything like that?
No, nothing like that.
Do you still have your tonsils?
Yes.
Okay. Your neck, do you have any neck pain? Do you have full range of motion in your neck?
Mhm.
Okay. Any lumps or swelling or swollen lymph nodes that you notice in your neck?
No.
Okay. Your breasts, do you have any lumps or pain and anything like that?
No.
Okay. Do you perform self-breast exams?
Yes.
Okay. And you haven't noticed anything?
I haven't noticed anything.
Okay. Do you have any tenderness to your underarm area? No lumps or swelling there either? Okay. As far as your respiratory system, you said that you do have asthma.
Yes.
How often would you say you have an exacerbation?
Maybe like every couple months. It's pretty rare. Sometimes with cold weather,
Okay.
but it's pretty rare.
All right. Do you have any trouble with breathing, shortness of breath, or anything like that
Not
with
normally,
exercising?
not normally.
Okay. No history of pneumonia or tuberculosis?
No.
Okay. Have you ever experienced chest pain, tightness, or pressure?
No, I haven't.
Okay. Have you ever been told you have an irregular heartbeat?
No.
Okay. And how about any swelling in your lower extremities at all?
No.
High blood pressure?
No.
Okay. Your legs, have you ever noticed any coldness, numbness, tingling,
No.
swelling, or any kind of varicose veins or anything like that?
No.
Okay. Do you have any food allergies or GI trouble at all?
No, I don't.
Okay. Do you feel like you frequently urinate, or you feel like it's pretty normal?
Normal?
Do you get up at night to go?
No, not normal.
Okay. Do you have arthritis? Experience any joint pain regularly?
No.
Limited motion or broken bones?
No.
Okay. Any history of seizure, stroke, fainting?
No.
Okay. Do you tend to bleed a lot? Like if you have a wound, does it bleed a lot or clot fairly quickly?
I've never noticed that. It
Okay.
clot fairly quickly, I would say.
Okay. Do you bruise easily?
No.
Okay. Are you diabetic?
No.
Have any issues with your thyroid?
No.
Okay. Have you noticed any intolerance to heat or cold?
No.
Okay. As far as your functional assessment, your self-esteem, do you have any concerns about your income, your health? Do you have any religious beliefs that we could use here to treat you?
Nothing I need help with.
Okay. What is the last degree that you completed?
I have a bachelor's degree and an associate's degree.
Okay. Your sleeping habits. Do you feel like you sleep okay at night? You feel well rested?
I do.
Okay. Do you take any naps at all?
Not normally, maybe occasionally.
Okay. How many hours of sleep do you get at night, would you say?
About 7.
Okay. How would you describe your role with your family? I mean, do you guys get along well?
Yeah, I'm very close to my parents.
Very close. Okay. How would you say that you get along with your friends, family, coworkers? Any conflict or trouble?
Not normally.
Okay. Okay. Who do you turn to for support if you were to have an issue?
Close friends or family, my mom.
Okay. Do you enjoy time to yourself? Is it enjoyable or do you feel isolated?
No, I'm fine with being by myself.
Okay. Do your religious or spiritual beliefs play a role in your life?
Yes.
Okay. Do they affect how you think about your health and care for yourself?
I guess in the long run, yeah.
Okay. Are you a part of any religious or spiritual community?
I go to church.
Okay. And you kind of said this earlier, but there aren't any religious or spiritual beliefs that could affect your care here. Is that correct?
No.
Okay. How do you cope or deal with stress?
Exercise helps me cope with stress or talking to somebody.
Okay. Do you feel like that generally works for you?
Yeah.
Okay. As far as your environment at home, do you feel safe at home?
Yes.
Do you feel safe at work?
Yes.
Do you have any concerns about any of these areas?
No.
Okay. And what do you do for a living?
I'm a nurse.
Okay. Do you have any exposure to radiation or bloodborne pathogens on a regular basis?
Not on
anything
a
like that?
regular basis.
Okay. Do you ever wear or have to wear protective equipment?
No.
Okay. Any work injuries?
No.
Work-related injuries? Okay. Any concerns about anything else?
No.
Okay. Well, we are done with your health history. I'm going to
Okay.
go and talk to the doctor and relay all this information to him, and he will come in and talk to you about your allergies and your asthma that's going on.
Thank you.
Okay. Thank
Okay.
you.